Today we will discuss ALS, but really quickly, are you fed up with lectures using complex vocabulary to appear smarter? Whether you're a current student or healthcare provider, doctor, nurse, or pharmacist seeking to remain up to date, this channel will provide a simple way of teaching emergency medicine in layman's terms. Here on Emergency Medicine on Demand, my goal is to help you retain tons of information in the shortest amount of time possible. ALS, or amyotrophic lateral sclerosis, is a progressive neurological disease that affects nerve cells in the brain and spinal cord. In simple terms, it gradually weakens the muscles and can lead to loss of movement and coordination. Signs and symptoms of ALS. Here are some common signs that may indicate ALS. Muscle weakness, noticeable weakness in arms, legs, or hands, twitching and cramps, uncontrolled muscle twitching, fasciculations or cramps, difficulty speaking, slurred speech or trouble forming words, difficulty swallowing, problems with swallowing food or liquids, fatigue, feeling tired more easily, especially after physical activity, changes in coordination, clumsiness, or difficulty with everyday tasks. Next steps. If you experience these symptoms, it's important to see a healthcare provider. They can perform tests to determine if you have ALS or another condition. Early diagnosis can help managing the disease and planning for future care. If someone has ALS, here are simple steps to take. See a doctor. Regular visits to a neurologist for checkups and management. Stay active. Encourage gentle exercises as tolerated to maintain strength and flexibility. Nutrition. Focus on a balanced diet to ensure proper nutrition. Assistive devices. Use tools like wheelchairs or speech aids to help with mobility and communication. Support. Join support groups for emotional help and share your experience. Plan ahead. Discuss future care needs and preferences with family. Home modifications. Make changes at home for safety and ease of movement. Stay positive. Encourage a positive mindset and engage in enjoyable activities. Always consult healthcare professionals for personalized advice and support. In the hospital, here's what they typically do to help someone with ALS. Diagnosis. Confirm the diagnosis with tests and exams. Monitoring. Keep an eye on the patient's condition to manage symptoms. Medication. Give medications to help with muscle cramps, pain, and other symptoms. Breathing support. Provide tools like ventilators if breathing becomes difficult. Nutrition. Help with feeding through special diets or feeding tubes if swallowing is hard. Physical therapy. Offer exercises to maintain muscle strength and flexibility. Occupational therapy. Provide tools to make daily activities easier. Emotional support. Offer counseling or support groups for mental health. Care planning. Discuss future care options and preferences with family. The goal is to help manage symptoms and improve quality of life. Here are some commonly used medications for managing ALS. Riluzole, brand name Rilutech. This is the first drug approved for ALS, which may help slow the progression of the disease. Edaravone, brand name Radicava. This is another medication that may slow down the decline in physical function for some patients. Baclofen, often used to reduce muscle spasticity and cramps. Baclofen is a muscle relaxer. Tizanidine, brand name Xanaflex, helps relieve muscle tightness and spasms. Gabapentin, a seizure medication, brand name is Neurontin. It's used for nerve pain and may help with discomfort. Antidepressants such as fluoxetine, brand name Prozac, or sertraline, brand name Zoloft, to manage mood and emotional well-being. Always consult a healthcare provider for personalized medication and recommendations. People at an increased risk of developing ALS include: number 1, risk is age. Most commonly affects adults between 40 and 70 years old. Gender. Men are slightly more likely to develop ALS than women. Family history. Those with relatives who have had ALS are at a higher risk. Certain occupations. Jobs involving heavy physical labor, military service, or exposure to toxins may increase the risk. Genetic factors. Some genetic mutations are linked to a higher chance of developing the disease. Smoking. Smokers may have a greater risk compared to non-smokers. While these factors can increase the risk, many people with these traits never develop ALS. Now you need to watch my video on alcohol withdrawal or have a look at benzodiazepine withdrawal.